Welcome, and thank you for joining an overview of diabetes management and the Quality Payment Program. Because Metastar is providing CME credit for this learning module, we need to inform you that no commercial support has been received and there are no planner or author conflicts of interest. For CME credit or a CME attendance certificate, you will need to complete the learning module and an online evaluation found on mpro.org. The Quality Payment Program was created by the Medicare Access and CHIP Reauthorization Act of 2015 and is a new approach to paying physicians and clinicians who treat Medicare beneficiaries. Under the Quality Payment Program, physicians and clinicians can choose from two payment paths: the Merit-Based Incentive Payment System, or MIPS, or the Advanced Alternative Payment Models, or APMs. The Centers for Medicare and Medicaid Services is merging aspects of the Physician Quality Reporting System, the Value Modifier Program, and the Medicare Electronic Health Record Incentive Program to create MIPS. Beginning in 2019, MIPS will pay eligible physicians and clinicians for providing care based on 4 performance categories. If you decide to participate in MIPS, you will earn a performance-based payment adjustment to your Medicare payment. So how does MIPS work? You earn a payment adjustment based on evidence-based and practice-specific quality data. This shows you provided high quality and efficient care by reporting information for the following categories: quality, improvement activities, advancing care information, and cost. The cost category will be calculated in 2017, but will not be used to determine your payment adjustment. With the healthcare industry's current focus on improving quality-based metrics, it is important to consider how managing your patient's diabetes can help you to meet measures for several reporting programs. The Centers for Medicare and Medicaid Services Quality Payment Program streamlines previous programs like the Physician Quality Reporting System, or PQRS, the Value-Based Payment Modifier, and the Medicare Electronic Health Records Incentive Program into one comprehensive program called the Merit-Based Incentive Payment System, also known as MIPS. You are likely already taking steps to ensure that patients with diabetes are being identified, diagnosed, and managed. Throughout this video module, we will talk about ways that you can use your current focus on diabetes care to support successful participation in the MIPS Quality Payment Program. Specifically, we will be highlighting examples of quality measures and improvement activities that align with diabetes care and patient self-management. Eligible physicians that participate in MIPS will be evaluated on 4 program categories. The first category is the quality category. The quality category replaces the PQRS program and will make up 60% of the MIPS score. Individuals will select and report on 6 measures, including 1 outcome measure, for a minimum of 90 days. Groups will select and report on 15 measures for a full year. The CMS Quality Payment Program features a variety of quality measures focused around diabetes care as well as patient self-management. Selecting and working to improve these measures can support patient care and prevent future complications such as heart disease, neuropathy, and amputations. Examples of these quality measures include Quality ID 1, diabetes, hemoglobin A1C poor control. This measure tracks the percentage of your patients aged 18 to 75 who have been diagnosed with diabetes and had hemoglobin A1C greater than 9% during the measurement period. Quality ID 117, diabetes eye exam. measures the percentage of patients aged 18 to 75 with a diagnosis of diabetes who had a retinal or dilated eye exam by an eye care professional during the measurement period, or who had a negative retinal exam with no evidence of retinopathy in the 12 months before the measurement period. Quality ID 163, Diabetes Foot Exam. Measures the percentage of patients aged 18 to 75 with a diagnosis of type 1 or type 2 diabetes who received a foot exam during the measurement period. Here, a qualifying foot exam is defined as a visual inspection and sensory exam with monofilament and a pulse exam. Quality ID 128, Preventive Care and Screening, Body Mass Index Screening and Follow-up Plan. Tracks the percentage of patients 18 and older with a body mass index, or BMI, documented during the current encounter or during the previous 6 months. When BMI is outside of the normal parameters, a follow-up plan must be documented during the encounter or during the previous 6 months. Quality ID 317, Preventive Care and Screening, Screening for high blood pressure and follow-up documented. Measures the percentage of patients 18 and older seen during the measurement period who were screened for high blood pressure and who had a recommended follow-up plan documented based on the blood pressure reading during that encounter. The second MIPS Quality Payment Program category is the Improvement Activities category. This new category will make up 15% of your MIPS score. If your practice is a designated patient-centered medical home, you will automatically receive full credit for this category. Individuals will select and attest to completing up to 4 improvement activities depending on the weight of the activities. Groups with less than 15 participants or those in a health professional shortage area will need to attest to completing 2 improvement activities. Performance of improvement activities must occur over 90 consecutive days in order to attest completion during reporting. Selecting and working on improvement activities related to diabetes management can make a difference in the current and future health of your patients. Examples of improvement activities that promote diabetes self-management include engagement of patients, family, and caregivers in developing a plan of care. This activity promotes the engagement of patients, family, and caregivers in developing a care plan while prioritizing their goals for action. Additionally, the plan of care must be documented within your certified EHR technology. Implementation of condition-specific chronic disease self-management programs. This activity focuses on the provision of condition-specific chronic disease self-management programs or coaching. One example of this program includes the free 6-week Diabetes Personal Action Towards Health program, also known as DPATH. We will share more information about how to host a DPATH workshop in your office near the end of this video module. If you are not able to provide these programs on-site, you can link patients to community programming. For a list of current evidence-based lifestyle change programs in your area, visit myhealthyprograms.org. Diabetes screening. This activity focuses on completing diabetes screening for people with schizophrenia or bipolar disease who are using antipsychotic medication. Glycemic management services. This activity relates to outpatient Medicare beneficiaries with diabetes who are prescribed anti-diabetic agents such as insulin. For the first performance year of this activity, you must attest to having at least 60% of medical records with documentation of an individualized glycemic treatment goal, the that accounts for patient-specific factors like age, comorbidities, and risk for hypoglycemia. At a minimum, documentation must be reassessed annually. Beginning in the second performance year and continuing onward, the performance threshold will increase to 75%. Therefore, attestation must meet this threshold in performance year 2. For all performance years, medical records must be those of patients who are being treated for at least 90 days during the performance period. Did you know there are also improvement activities related to engaging with MPRO as part of Lake Superior Quality Innovation Network? To learn more, visit lsqin.org. The third MIPS Quality Payment Program category is the Advancing Care Information category. The Advancing Care Information category replaces the Medicare Electronic Health Record Program, also known as Meaningful Use, and will make up 25% of the MIPS score. Determine which participation method for MIPS you wish to use in 2017. Test pace, partial year, or full year participation, and then complete the requirements associated with that participation method. The final category is cost. The cost category replaces the value-based modifier program and will count towards your MIPS score beginning in 2018. This category will evaluate eligible clinicians on measures related to resource utilization calculated using Medicare claims. Implementing strategies that engage your entire staff and patients in managing diabetes, utilizing electronic health record features, and understanding where to find resources are all ways to improve the health of patients living with diabetes and prevent or delay complications. A best practice for helping patients self-manage their diabetes is to refer them to an evidence-based lifestyle change program, such as a free 6-week Diabetes Personal Action Towards Health or DPATH workshop. MPRO is a licensed DPATH provider in the state of Michigan and employs trained leaders who host these workshops in your office. For more information on how to host a workshop for your patients, visit lsqin.org/initiatives/diabetes-care and scroll to the bottom of the page for the Michigan-specific point of contact. Additionally, sharing diabetes measure data with your staff, such as NQF59, hemoglobin A1C port control, provides an up-to-date look at your patients with diabetes whose A1C is in poor control. In turn, sharing this data can help drive improvement and improve overall patient care. The American Association of Diabetes Educators recommend 4 critical times to refer patients to diabetes self-management education. These times are when patients are first diagnosed with diabetes, at annual exams or yearly check-ins, when a new challenge is presented, either related to their diabetes or in the patient's day-to-day life, and when there are changes in a patient's healthcare, such as a new physician, insurance plan, a new living space, or age-related health issues. For more information on clinical diabetes education, visit diabeteseducator.org. Did you know that MPRO can provide you with a variety of resources for your diabetes workflow? This ensures that your practice is identifying and managing all diabetes patients, as well as those most at risk for developing type 2 diabetes, known as prediabetes. For more information on how MPRO can support you, visit mpro.org. Finally, to learn more about the Centers for Medicare and Medicaid Services Quality Payment Program and the eligibility criteria, visit qpp.cms.gov.